today. Before we get started, I'm going to go ahead and introduce our panelists for today's COVID-19 press conference. The first panelist is Ms. Catherine Wells. We all know and love her, Director of Public Health. Next, we have Dr. Ron Cook, Public Health Authority. And we'll also have with us today Mayor Pro Tem, Mr. Steve Massengale. I'm going to turn it over to Catherine Wells to open up the press conference.
Thank you, Abby. Today, I'm actually joining you all from the Civic Center after a one-day delay of our COVID vaccination clinic. We were able to reopen this morning for both first and second dose appointments. The delay that we saw was due to a statewide disruption in vaccine distribution from the winter storm last week. The department was able to secure enough vaccine to operate the clinic through Saturday due to a willingness of some of our community partners to transfer vaccine to us. However, the expected shipments from the state still hadn't arrived at the health department on Monday, and unfortunately, we were required to cancel the clinic yesterday. If you had an appointment scheduled for that clinic, Tuesday, February 23rd, you do not need to reschedule. We encourage you to come out to the Civic Center either today, Thursday, or Saturday. We have vaccine for you and your appointment will be honored. If for some reason you're unable to come this week, please call the health department at 775-2933 and staff will work to rebook your appointment. Part of the reason why we ran so low on vaccine was that we were actually able to hold all of our planned clinics last week during the winter storm. I want to thank everyone that came out to the Civic Center last week in the big storm. A special thanks to all of our volunteers and city staff, including our streets department and parks and rec, who kept our parking lot sanded and the walkway shoveled. Also a big shout out to all of the staff at the Civic Center who kept this building operating, warm, and kept welcoming all of our community members. I'm impressed with the number of citizens who braved the cold and snow to make it to the clinic. It really shows how important it is that we vaccinate our community. We now have over 30% of our eligible population vaccinated. But that still means we have a lot of you who have not received your vaccine yet. If you are eligible, please make an appointment. We still have some appointments available this week for the Civic Center. You can do that you can make your appointment by calling the health department or going on the Select a Seat website. We are continuing to follow the state of Texas guidelines for vaccinations. You must be in the 1A category, which are our healthcare workers, first responders, home health, or be in the 1B category, which is either that you're over 65 or you are between 18 and 65 and you have one of the state qualifying health conditions such as diabetes, obesity, or cancer. I usually start off my presentation talking about our COVID case count numbers, but we are doing really well and our numbers continue to remain low. We are averaging less than 50 cases a day. We've even seen cases below 20 in the last week. I encourage everyone to continue with all of the public health practices we've talked about in the past, wearing your mask, remaining socially distant, and keeping up with good hygiene. We are not out of the woods yet, but if we can keep our viral load in our community this low and continue to vaccinate at the rate we're vaccinating, we are going to get through this as a community. With that, I will pass it over to Dr. Cook.
Thank you, Catherine. I too want to say thank you to our good citizens in Lubbock. For those of you that are eligible to have come down and received your vaccine, and all of the rest of you that are doing your part to slow down this virus by wearing your mask and socially distancing and washing your hands. The other group I want to say thanks to are our volunteer group that's helping move people through the Civic Center for this vaccination, and all of our staff, city staff that are there, all the different people that are employed by the city, but they're coming down and helping out at the Civic Center. Without that, Without you individuals volunteering or being down there as staff, we couldn't have immunized this many people thus far. Thank you so much. And because of everybody's efforts, our hospital numbers, as you know, are very, very low. Our infection rate is less than 50, as Catherine said, and our hospitalization for COVID patients yesterday was only 4.98%. That is fantastic. You know, it's 1 point we were well above the 40th percentile of all of our patients that were admitted. So this is great news. Our hospitals are still full, so be safe out there. Last night we had 10 patients that needed beds in the hospital that we're not able to provide a bed for immediately. They eventually got beds. But please, because our numbers are so low, don't think that we're out of the woods, as Catherine said. Don't let your guard down, wear your mask, socially distance. You know, this virus is still very, very lethal, and we don't know who will do poorly. Remember that we have now gone over, in the nation, we have now gone over 500,000 people have passed away related to COVID infection. And as you've heard, that's more than our last 3 great wars that we've had put together. It is a significant disease. Please do not take it lightly. Remember, as Catherine said, if you've already received your dose and you're eligible in that 1A and 1B group, come get your vaccine and make sure you get the second dose of that vaccine. It's a very safe vaccine, and there have been no bad outcomes so far. So please come get your vaccine so we can continue to slow down and stop this virus. You will, even if you've received the virus or the vaccine, you will still need to wear a mask. Don't get lackadaisical about not wearing a mask. We still need you to wear a mask and socially distance. It protects you from infection, but what we don't know is if it prevents you from spreading it to somebody else. And so we still need you to wear your mask. Now, we wear masks for 2 reasons: so that I don't get infected and so that I don't give it to you. We wear masks for the same reason your car has an air filter, to filter that air. And the same reasons that surgeons wear masks in the operating room, so they don't give you an infection during their procedure or whatever that procedure might be. Masks work, and we must continue to wear masks for now. We also have those antibody drugs. So if you do get infected and you're positive and you're over the age of 65, or you have a significant comorbid condition like hypertension and diabetes or chronic kidney disease, obesity, and you are positive, within those first 5 days, please come down to the hospital, the former Grace Hospital at 50th and University, and get those drugs so we can make sure that you do well and stay out of the hospital. I want to talk a little bit about mutations again. Really, the biggest mutations that we're seeing are drugs. Our vaccines are covering those mutations. But really, the only way viruses mutate, and viruses mutate on replication. When they multiply in your body, that's when they mutate. And the mutations that don't amount to anything aren't really passed on. It's those mutations that have developed the immunity to avoidance of our drugs. And the only way that they mutate is if they replicate. And the only way they replicate is if they infect somebody and have a host to replicate in. So the whole goal there is not to allow any kind of replication by not getting the virus. So therefore, wearing your mask and socially distancing and washing your hands, all the reasons to stop those mutations. I will say right now that California has their own mutation, and it's significantly more infective because it produces significantly more virus. So that makes it more infective. And so stay away from California. And there's a number of other hotspots that include the East Coast. So I know many of you are thinking about spring break. It's just around the corner. I know most of the universities here in Lubbock have an abbreviated spring break, only 1 day, because we have a late start related to the beginning of the semester. If you decide to go on spring break, please stay regional. I would not, again, recommend going to California. I would not recommend going to any of the Atlantic seaboard, those are hot spots over there. And so just be careful. Stay with roommates that you're already exposed to, or stay with family members that you live with if you do decide to travel. A little bit of vaccine update. Johnson & Johnson, their vaccine has been approved. I expect that Texas and then ultimately Lubbock will start getting some of those doses of the Johnson & Johnson vaccine. The good news is about the Johnson vaccine is that it's only one dose, and it's about 65 to 70% effective at one dose. That's good news. And it requires normal refrigeration. And so that's good too. So any clinic, your primary care provider can store it in their refrigerator for up to 3 months. And again, it's a single dose, not 2 dose. I do also have heard that Pfizer is asking the FDA to approve storing its vaccine at higher temperatures, so it's easier for clinics and primary care providers to store it in their own offices instead of having those ultra cold -80-degree freezers that are fairly expensive. With that, please wear your mask, stay socially distanced, wash your hands. Remember that virus cannot mutate if it's not replicating, and the only place it has to replicate is in your body, so don't get infected. Be blessed. Let me hand this off to Mayor Pro Tem, Steve Massengill. Thanks so much. Good to see you all.
Thank you, Dr. Cook. Good morning, everybody. Thank you for joining us. I'm going to start this morning by sharing our slide deck that we normally share. Okay. This is the graph that we're used to seeing. It shows the trend of our hospitalization rate that we've been so focused on. I think this is the trend. This is trending the way we want it to trend. As Dr. Cook mentioned, that we actually got down into the 4%. So it's something we're thankful for. Again, this is by age distribution. I don't think there's any really new news here, except that we continue to see this distributed, the case count across all age groups. This is the new graph we've been showing to reflect our availability of hospital beds. Looks like we were a little upside down yesterday, but I think we feel like we'll be right side up as we move forward. This is an important graph, again, to show vaccines administered. As we see this graph develop, you'll continue to see more orange. That means that those are individuals in our community that have been vaccinated both times and would be considered fully vaccinated. So more good news from that slide. Okay, stop. Should be back with you now. Okay, before I get started, just let me say on behalf of the mayor and the city council, we understand, although there's good news to communicate today, that we're still in the pandemic, and those that have experienced loss or are still sick or the stress related to the pandemic, that we extend our sympathies to you, and also those businesses that are still affected. We're not out of the woods by any stretch of the imagination, and I more than anyone understand the stress on those small businesses, so you're certainly in our thoughts. Good news around vaccines. We continue to work with our partner, United. Catherine may have mentioned that earlier, but we still provide them with vaccines, and we appreciate them providing some alternative locations for citizens to get vaccines. So some more good news. I want to talk about how many vaccinations we've had in Lubbock County. Total doses administered are around 84,000. First doses around 57,000, and around 27,000 people are fully vaccinated of those that are eligible. So here's the great news on this, is Lubbock leads the state in percentage of those vaccinated that are eligible. We sit at around 38% that people that are eligible that have been vaccinated, and right behind us are the combined Randall and Potter County. I think they sit around 35%. So I just want to take the time to thank our staff. We can't brag on our public health department. Matter of fact, our entire city organization with the storm we've just dealt with, and we continue to vaccinate people regardless of what challenges face us. So we're extremely proud of them. We're extremely proud of being the first in the state. A lot of people have questions about when that next phase of vaccinations, the next group of eligible people will come online, and we're working closely with the state, and we don't know what that is today, but we'll continue to work with them, and as soon as we know, we'll communicate that to you. Okay, next, I want to talk about some reopenings as we gradually reopen, and mainly facilities that are related to the city of Lubbock. So effective March 1st, we'll start gradually reopening some things. So the next city council meeting will be hybrid. So we'll have in-person, and we'll have the availability of participating virtually in that council meeting. That council meeting will be March 9th. So we look forward to that. We are ready to approve outdoor events again. As you know, we still sit under the governor's order GA 32, but that gives the mayor the authority on authorizing outdoor events. You're able to gather up to 10 people right now, from 10 to 50. There's a self checklist, and let me remind you of the website. We haven't referred to this in a while. It's mylubbock.us/LubbockSafe. But we'll go back to the protocols we were using before we locked down because of hospitalization to get your events approved. And so 10 to 50 people in your outdoor event, you'll self-certify on the website. 50 and above, you'll send an application in through the website, and the mayor's office will approve or advise you on that outdoor event. So let me just go through, hit some highlights of the city facilities and what they'll be doing. The museums, garden and arts will allow rentals with safety plans starting on March 1st. Libraries will allow rental of rooms with safety plans starting March 1st. We'll slowly start beginning some of the programming at the library, and probably something doing like story time will begin. Parks and Recs, community centers will reopen at 75%. There'll be no day camps or dances. Our senior centers will remain closed. As a reminder, our senior meal program will continue with delivery and curbside. Outdoor, again, I already talked about how outdoor events will be approved. The amphitheater, the programming at the amphitheater will begin in May. Keep in mind, our Civic Center is still committed to vaccinations. And so after April, organizations will have access to the banquet hall and the theater, but we have to keep the Civic Center prioritized for vaccinations at this time. The next most important thing I have to share with you is we're going to move our press conferences to every other week. We stay focused on vaccinations, and if there is new information to share in between that time, we will certainly communicate that to you. Our next press conference will be March 10th at the same time. As I wrap, I just want to thank everybody, thank our citizens as they continue to work together and work with us as we fight the vaccine. I also want to still thank them for how everybody handled themselves during the storm last week. Stay safe and be healthy. Enjoy your week and enjoy the much milder weather. My gosh, what a difference a week makes. With that, I'll hand it back to Abby and Mark.
Thank you, Mayor Pro Tem. Now we're going to go into our media question portion of the press conference. I want to thank all of our media partners who are able to join us today. I also wanted to remind everyone we're going to try to keep it to one question and one follow-up question for each outlet. So we will start off with Grace Morris with KLBK News.
Hi, everyone. Thanks for having us today. So my first question is, are you guys happy about the amount of vaccines Lubbock's getting, or is there something else that you would, want from the state if you could ask for anything more?
Let me start with that. We're grateful for what we've gotten. I'll just tell you that we asked for more vaccines. We feel like we have the capacity to administer more vaccines. So we continue to be the squeaky wheel, but we are grateful for what the state's done for us. Catherine or Ron, if you have anything to add to that.
I'd agree. We are always asking for additional vaccine. If we get it, we will administer it as quickly as possible.
Okay, and then just to follow up, Lubbock is giving out the Moderna vaccine, but are you guys still getting shipments of Pfizer? And I guess, Dr. Cook touched on a little bit of hopefully the Johnson & Johnson vaccine as well.
The hospitals are receiving the Pfizer right now. They're the ones that are most capable of the current refrigeration and freezing requirements required for the Pfizer, which are certainly more strict than the Moderna vaccine. I suspect that if the FDA approves the Pfizer to raise its temperature to normal freezer requirements, this community will receive more Pfizer vaccine. We expect to be, I think there was 1 billion doses is what I saw in the news for the Johnson & Johnson vaccine. So yes, let me praise our leadership in the city for doing their best, and as Mayor Pro Tem says, being the squeaky wheel in Austin, making sure that we were a vaccination hub where we can give out lots of vaccine, and making sure that our community is receiving the vaccine as much as possible.
All right, thank you guys.
Thank you, Grace. Next, we have Olga Aguero with El Editor.
Buenos dias. Good morning to all. Glad to see everyone.
Good morning.
I got on a little bit late. I don't know if this has already been asked or the information has been given out. Since the numbers are low on the COVID testing, how many testing are going through in a daily basis? If you can sort of mention that to us, Catherine. Like we got 27 at one time, but how many people got tested that day?
I'm not in my office right now, so I don't have that number right in front of me. We continue to have all 3 or 4 of those TDM sites open. So anybody who wants to get tested or was exposed, we encourage them to still use those resources. We shouldn't be seeing reduced case counts because people aren't getting tested. There's lots of testing available in the community and for free.
So yes, and that's what we need to continue to asking people to get tested. Am I correct?
Yes, everybody still needs to get tested. Testing is an important component in controlling this virus. It's just as important as the vaccine. We need to have all of those different measures in place.
Olga, you bring up a good point. If you feel sick, please get tested so we can keep trace of that. Not only for contact tracing, but just so that we know the amount of virus and disease that's in our community. So just don't think, oh, well, I've got the COVID, so it'll all be fine. Please come get tested so we have record of that, so we can monitor that level of disease in the community.
Thank you. The other question is, I understand that there's 30% population here locally vaccinated. Are we, or is there a breakdown ethnically for this figure?
Yeah, we continue to work on the race and ethnicity breakdown of the data. We're starting to see more and more of that reported. We've been requiring that at the health department or at the Civic Center Clinic for a few weeks now. And we're starting to see more, but I don't have, there's still a lot of unknown in that data figure. We're working on it though.
Okay, just for point of information, I just would really encourage for that information to be available. So I think that would encourage the groups that do need the attention and do need to get the vaccine. So if numbers can be appeared and be presented to the public in general, that would help us, get the word out to them. And thank y'all for y'all's time. God
And
bless.
can I make a clarification there, Olga? We have 38% of the eligible population in our community vaccinated. That's not 38% of total population.
Exactly. Yes.
Okay.
Thank you.
Thank you, Olga. Next, we have Karen McKay with KCBD.
Good morning, everybody.
Good morning.
Steve, I think, Steve, you made everybody so happy when you talked about Lubbock opening up more. That sounds so fantastic. And at the same time, people are really getting tired of wearing masks. Even after both doses being fully vaccinated, we're told to continue to wear a mask, as you explained, Dr. Cook, about this being basically an air filter for illness. So my question, I think I'm hearing this from a lot of people, do you see an end in sight to wearing masks?
Karen, that's a great question. I think until we get closer to herd immunity, which is, some people would say 70 to 80% of everybody vaccinated, we just don't know enough about this virus that even if you are vaccinated, whether or not you can spread it. You could be vaccinated where it doesn't replicate in you, but you could harbor it in your nasopharyngeal passages and hand it off to somebody else. That's the biggest concern. And just making sure that we don't reinfect ourselves down the road. And right now, we think the vaccine's going to last several months. They are doing the studies now to show how long it will last. And so we don't have any data on that. And so, it would be a sad scenario if you did your best, you got vaccinated, you got your second dose, and 6 months later came down with it and had a bad outcome. And the best way to do that is to prevent that is to continue to wear a mask. We know that our flu cases are a third of what they have been compared to last year and the year before and the year before. So we know that masking works.
All right. One other thing I wanted to ask, if you could just explain, it's a little confusing on the hospitalization. One day it'll say there are 45 beds remaining as it was Monday, and then the next day it was -10.
Mm-hmm.
And then last week we had the same thing. I don't understand that drastic flip that we're seeing sometimes. And I wonder is it because we're including more than just COVID cases in that number as far as the need for more beds?
Sure, that number is part of what we call the BRAC, Region B of the Regions Emergency, the hospitals in the entire region. And so our hospitals, this is the tertiary care center for this entire region. So between Dallas, Fort Worth, and Albuquerque, our hospitals, we're a tertiary care center. And so what we really haven't paid attention to publicly or not been on a public dashboard per se is what these numbers look like even before COVID. We were watching those with COVID because that determined whether or not these hospitals were able to do elective surgeries and all the other things that would normally take place outside of COVID. So I'm sure we had days in high hospitalization rates even before COVID around this time of year anyway. In the past, it's been related to flu, it's been related to trauma, it's been related to all the other things that normally take place. All that to say is our hospitals are back to normal business. Our COVID numbers are significantly low that they can open up back to normal business. And so we're going to have days where we have plenty of beds and then days where they're going to be short beds until we can get patients turned around and discharged and have those beds available. They're at their saturation rate. They have beds, but when we look at a negative bed, that just means we have 10 patients, for example, last night that needed a bed in the hospital that couldn't get a bed until we discharged patients this morning. And so that fluctuation occurs. It's just never been on the public forefront as it is now. And we are watching that because of our COVID numbers were so high. And now that our COVID numbers are down, the hospitals can do their normal daily business.
So it may not reflect entirely a COVID situation right now.
No, it's not.
Okay.
Our COVID hospitalization numbers are 5%, 4.98%. Now remember, when we're in the peak of this in November and back in the summer, we were well above 40% of our hospitalization patients were COVID.
Okay, thank you. That explains it. Appreciate it.
Yeah. Thanks, Karen.
Thanks, Karen. Next, we have Bao Pham with the Daily Toreador.
Good afternoon, everyone. So I have a question. So Dr. Cook mentioned that there has been a new infectious strains cited in California. So will Lubbock citizens need a booster for this more infectious strains once it head to Lubbock?
Bao, right now, it looks like our current vaccines, the 3 that are out there, are covering our current mutations very well. And so, not yet, but as viruses mutate, there's a high likelihood at some point that we will have to have a booster. And that booster may be related to how long the vaccine lasts. Just like flu, we have to get a vaccine every year because those viruses mutate. And so as a result, we may have to get a booster shot every year with this particular virus.
All right. I have another follow-up with what you mentioned. So you said that we will be able to not use masks when we reach herd immunity, which is around 70 to 80%. Is that correct?
Yes, that's correct.
So with that being said, with how we are doing with the vaccination, I believe that it will take quite a while to reach that amount. So what is exactly the reason why the city decided to open up and allow group gatherings when we haven't actually reached herd immunity yet?
And maybe Mr. Massingill can help, but our COVID numbers are significantly decreasing. And it's vitally important that we get back to a normal economic base and economic effort for all the individuals in our community for viability of their businesses. That can be done. We can do that. We can open up. But again, we need to be very cautious about this virus. We still need to wear our masks and do our best to socially distance in an appropriate settings. And fortunately, the weather's getting a little warmer. We can be outside a little bit more, but we're still going to have to wear masks and continue our hand washing and social distancing until we get to this herd immunity. I suspect probably by the end of the summer. I know that's a long time away, and I know that you're tired of wearing masks. I'm not a surgeon by trade, but I wear a mask quite frequently, and it's our life right now. And again, it works because we know that our flu numbers are significantly lower than in the past because of what we're doing.
Yeah,
Right.
I would add what I would add to that, Dr. Cook, is keep in mind we're under an order of the governor, and we're reopening within that order, just like we were open prior. And I agree, as we warm up, there's things that are important that we need to get out and be doing, and we can do those things safely while maintaining social distancing and wearing our face coverings. Youth sports, for example, again, as it warms up, it's important. We can allow our kids to participate in youth sports and still be safe, and I think we can do that gradually and safely.
Thank you, and stay healthy.
Thank you, Val.
Thank you, Bao. Next, we have Matt Dotre with the Avalanche Journal.
Good morning, everyone. Ms. Wells, have the vaccines filled up this week? And can you just kind of discuss what the plans are for what happens maybe if appointments don't fill up?
Yes, so we opened up appointments yesterday afternoon at 1. That was off our normal schedule of opening them up at 10. So they were slower to fill up. And this morning when I checked my emails, there were still some appointments left. I expect that we will fill up all of those appointments today. If, we do accept some, walk-ins, we don't recommend it. But if someone, really, needs a vaccine and they meet that 1A, 1B, and they come up to the health department, come up to the Civic Center, we will see whether or not we can work them into the schedule. But I do expect all appointments to fill up.
Okay, very good. And I guess along those same lines, if Lubbock keeps vaccinating at a higher rate than other cities, you would figure that Lubbock would get to the point where it could open it up to the 1C group prior to other cities. Do you kind of know what the state is planning on doing when Lubbock reaches that point? Like, are vaccines going to go elsewhere until they get to the same level that we are? Or do you think Lubbock could open it up to 1C before other cities?
We're going to have to wait for the state to actually make that determination. And when they allow us to open up to 1C, there's still a lot of people to vaccinate. And the other part is it's not just Lubbock community. This is a regional site. So we need to see, individuals from Hockley and Garza counties and Hale County coming into the Civic Center also. We need to see a regional increase, a regionally high vaccination rate.
Absolutely. Okay, very good. Thank you.
Thanks, Matt.
Thank you, Matt. And next we have Christy Martinez Garcia with Latino Lubbock Magazine.
Good afternoon, everybody.
Good afternoon.
Good afternoon.
Dr. Cook, I'm going to ask you the first question because I love your tie. Listen, we're seeing a lot of folks that have survived COVID, but they're dealing with a lot of complications, upper respiratory and heart and lung. What can they do to help, or is there any type of program that could help them to handle this situation? Because some of them are very severe.
Christy, we would direct the therapy toward, there are facilities, we have facilities that do pulmonary rehab. Just as if you had bad emphysema or COPD, we have facilities that help with pulmonary rehab to try to get your lungs stronger. We have cardiac rehab to try to get your heart stronger. And so they would probably be referred to those areas. All those areas have been in existence a long time, but this disease is showing us all kinds of new facets of what the chronic manifestations of this disease look like. And they include chronic fatigue and even neurological disorders, chronic brain fog related to it that lasts for weeks or months, post-COVID infection. And I think people have the idea, well, I just had a mild case of COVID. It's not that bad, so I don't need to wear a mask because I survived it and I did okay. But there are many, many people that have chronic organ-related issues that are manifesting themselves long after people get out of the hospital. Lung disease, heart disease, even this neurological disorders that are related to it. So, and we don't have good predictors really that who's going to be affected by that. So all the more reason, I just cannot say enough and often enough about wearing facial coverings and social distancing, etc. I know people are tired of hearing me say that, but I've seen these patients that have chronic neurological conditions and chronic heart conditions. There was a talk on NPR radio this morning that talked about chronic heart conditions related to it.
Thank you for that. Steve, or Councilman Massengale, I want to ask you about outdoor events, but before I ask you, you talked about us being first in the state, Lubbock being first in the state, and wouldn't you attribute that to also because we were a leader in deaths statewide and nationally? But I do want to ask you about outdoor events because we have people that are concerned that you still have to get approval when there's still so many indoor events that are being held and they're not getting approval. But
Well,
that's, I guess, the two questions.
I guess you squeezed in two questions there, Christy. I'm not sure there's a correlation, or I can't correlate This is our success rate at percentage of vaccinations of our eligible population and deaths. So I'm not sure how to answer that one for you. Again, the outdoor events versus the indoor events, what we can do is operate within the governor's order. That's where we've been for months. And the governor's order gives the mayor discretion on these outdoor events. And so we are fulfilling that responsibility as we approve these outdoor events. I believe that we can do this safely. We've done it safely before, and we're in a great place right now. We're not out of the pandemic. We don't get a pass on face masks. We don't get a pass on social distancing, but we can maintain those protocols. And I believe that there's outdoor events that we can conduct and participate in safely.
I know the CDC has put out some information about spring sports, and they even said that outdoor is lower risk than indoor. So hopefully we'll see some changes soon. Thank you guys for your time. We appreciate it.
Thanks, Christy.
Thank you.
Thank you, Christy. That concludes our media section of the press conference. I just want to thank everybody for joining us today. And I also want to remind everyone that our next COVID-19 press conference will be March 10th. And with that, I will close us out for today. Thank you.